Hello everybody. What is next? Refer pain. And why I call refer pain? Because I have a patient that said, oh my God, doctor, I need a break. I've been in so much pain and I'm very scared about a root canal. And then I look at a patient and to me, he looked like an elephant. I didn't know he was an elephant. I just look at him as a patient. And I said, don't worry, the root canals of today, I'm telling you, are not terrifying. I will make laugh the patients so they fall asleep. But in general, all my colleagues, all endodontists, we love what we do and we make your treatment very easy today. So what do we do first? We have to analyze your medical history. We have to analyze the history of your pain. What is the history of your pain? Do you really have pain? Did you have pain in one tooth, on several teeth? Or is your pain with cold, hot, sweet? Did the pain wake you up at night? Is the pain with cold last for a long time? Then that is a root canal, but for us it's very important. I always diagnose the whole quadrant. But the most important part, in my view, is to listen careful to the patient. Sometimes we're rushing. If your doctor is rushing, just tell him it's important he listen to you and listen to the story, because maybe you were grinding your teeth for a long time and you have pain in the teeth and it's not a root canal. Maybe you're really tight on your muscle. It's not a root canal. We're gonna see why refer pain can come from a different part of the origin. So let's say you have pain in one tooth and it can come from the other. We need excellent x-rays. The quality of the x-rays has to be excellent. It has to be perfect. I tell my staff I need a Picasso x-ray. And the most important test that we do in endodontics is the cold test. We use the dry ice and it's 70 degrees below, and that's the best that we can say. But if you want to have a test yourself, you have a little piece of ice in your hand and you can go tooth by tooth. And the one that lasts the longest, that's gonna be the one that is gonna need a root canal. Also, you have to tell your doctor if you have pain in another teeth so he can see you're gonna have a root canal in the tooth that you needed if you need it. That's why education is the most important part, that my patients have to understand why you have pain, why you need a root canal, how can you avoid the root canal, and what can we do to never have a root canal again. And maybe you don't need a root canal, it's just a night guard to protect your grinding and avoid fractures in your tooth. The first classification that we have, and this was done by Dr. Dudley Glick, which I was very lucky to start teaching in 95 for almost 20 years, teaching together with Dr. Glick until he passed away. He wrote an article that is a classic on refer pain, and we follow not only him but several people that publish in this after him. And the sinus pain is the most classic of all of the pain that I can tell you. Why? Because people has big flu, big sinus pain, the sinus is very stuffed, it's all swelling, and you start having pain in that area and it's in all the mouth. So what happens when it's all the mouth? Your whole quadrant is painful. You touch one tooth and the other and it's painful. And guess what? It's not a root canal. It's just an infection of the sinus. The maxillary sinus is so congested, it's creating a pressure. And what is the sinus, you will say? Oh, when you get into the nose has some openings and that is gonna drain to the space that is called the sinus. These areas are empty and are called sinus. So you have all this stuffy here. That stuffiness is gonna pressure every one of your teeth and create pain in all the teeth. Dr. Glick developed a technique that was, if you pressure around here to the patient and the pain goes crazy, then it's a sinus infection, not a root canal. Of course, we're gonna do all the testing, cold, hot, palpation, percussion, biting test. We measure some gums and we see if it's a gum problem or anything is stuck in there. So after that, everything looks normal. Even though they have a lot of pain, trust me, it can come from the sinus. So you have to treat first your sinus infection. And what will happen, let's say, oh, the endodontist made a mistake, or the dentist made a mistake and it's not a sinus and I have a tooth problem. The minute you have an antibiotic for a sinus infection, that is gonna help you to clear the infection of the tooth. And then you can come back to your dentist and say, I need to do a test again for that specific pain, and now you're gonna find the tooth if it was a root canal treatment. But most of the time it's the sinus because all the teeth are hurting. The other problem is the ear pain, and just like the sinus pain can come from trigeminal nerve, which is the 5th nerve of the cranial, then you're gonna go to the ear pain, which is the 7th nerve. And what is irrelevant, because when the nerve comes here and has some innervation, some extensions go to some areas of the teeth, and that's why you're gonna have pain referred to all the lower teeth, and then the pain is gonna go to the neck, it's gonna go to the side, it's gonna go to the head. That pain can come only from the ear, and the minute your dentist touches, that's gonna mean is an ear infection. Again, your dentist will give you antibiotics if he's not sure. If we're not sure it's a root canal, I'd rather bring my patients again. I will not charge again for the consultation. That is me, but I have to be sure that if it's a root canal, we're gonna open the right tooth. So how do we accomplish that? By listening to the patient. Guess what? I went swimming. So you went swimming and then you have that pain, tell your doctor. The same with the sinus. You got a cold and you're recovering, tell your dentist so we can have a better diagnosis. Now, what is a heart pain? That is the most important for me. Why? Because this is a matter of life or death. If you as a patient have pain on the jaw, the two jaws or one jaw, can be the left, can be the right, it doesn't matter in dentistry. But if you have that type of pain, can be referred from the heart. People think it's just the left, and the pain, if it's on the tooth, is all the teeth. But guess what? The pain that it comes in the heart is so potent that somehow we know it goes to the tooth. And if you go to the dentist and you're having a heart attack and the dentist doesn't send you right away to the hospital, then it's a problem. Most of the time nowadays, if I send the patient to the hospital, I will call to the hospital. Otherwise, the hospital will return the patient to the house and say, this is a toothache, not a heart attack. Be sure that you see your emergency doctor to say, I saw with Dr. Yackerman, and you be sure, give them my name. They can call me at any time, and I will answer in an emergency situation like that, and tell your doctor to please take a look at your heart. Be sure you're not a heart attack. I have two patients that one of them, we were very good friends at USC. He went to the hospital. They told him it was a tooth problem, and it was not a tooth problem. Dr. Vijay checked the patient before and referred the patient to the hospital, and the hospital returned the patient to the house. They never called Dr. Vijay, and the patient died as soon as he got back to the hospital, from the hospital to the house. And that is a very sad situation that could be avoided. But in this chapter of today, I wanted to explain to you the sinus, the ear pain, the heart pain, and trigeminal nerve trigger point muscle pain. And psychological pain comes in the next part that we're gonna see. And this is why it's important for all the public in general, whether you understand or not what I'm saying, to be sure that if you hear from me that is heart pain, can refer to the tooth, try to read, try to go to YouTube, try to go to Google, you will have an answer. And one of my patients said to put in my lectures to don't be afraid to use our brain because it will never wear out. As a matter of fact, the more you learn new things, the more your brain is gonna work. And very quickly, I tell you the story about this patient that has a tooth pain. This tooth pain was first referred by the maxillary sinus. Then the patient got cured of the maxillary sinus. We did the testing, and when we did the testing, everything was kind of normal. We bring the patient like 3 times. And I said to the patient, you have to go exactly what I said. Get your antibiotic, and then we can do the root canal. She did the antibiotic, she came better, and then we did the test again. Now, also the infection of the tooth can refer the pain to the sinus, but also the infection can be transferred to your sinus. So if you have a tooth infection, be sure you take care because they can refer from the tooth to the sinus and the sinus to the tooth. Even if your tooth was healthy, sometimes can get affected by the sinus infection, and a lot of us don't know. So the patient, this patient came back and she thought she needed another root canal, and then I had to talk to the ENT. He's specialized in ear, nose, and throat, and ask him to see the patient again because the patient did not need another root canal. It's just the husband prescribed to the patient medication, so the diagnosis was a little difficult to accomplish. So we have always to think if that's a sinus infection or a tooth infection. If you press here in the sinus, remember that is an indication if the pain goes worse. It's a sinus. Dr. Glick was funny, he used to say you have to pull the ear, and then you know if it's an ear pain or a sinus infection. But there's different tests of that. Just be sure you're not gonna do a root canal just because you think it's a toothache. That's why you have to be sure that you're communicating with your dentist very well, and you see an endodontist, which we specialize in these type of situations when we don't know what it is and it's not a root canal. We have a specialty that is called orofacial pain. They deal with migraine pain, and they deal with headaches. They're clustered headaches that refer pain to the teeth. They deal with muscle pain and trigeminal neuralgia or trigger point and any other ones. So I hope you like the chapter. If you have any questions, send it to YouTube, Instagram, or TikTok. Bye-bye.